Alright, so I'm going to walk into my patient's room, hand sanitize. I'm going to check the physician's orders for a wet to dry dressings change. I'm going to first check the patient's name and date of birth. Okay, and after I've identified the patient, I'm going to bring the bed up to a comfortable working height. I'm going to check the patient's pain, ask him on a scale of 0 to 10, what's your pain level, and he's going to tell me if it's anything over 5. I'm going to make sure that he has some pain medication. I'm going to come back 30 minutes later and start the dressing change. By starting the dressing change, I'm going to expose only the abdominal dressing. I'm going to wash my hands and don on a pair of clean gloves. And as I'm taking back the old abdominal dressing, I'm looking for color, odor, consistency, and amount of any fluids. I'm going to note that and then discard in a biohazard bag. I'm then going to continue by measuring the wound with my gloves. I'm going to take one of the Q-tips and measure about 13.5. I would then discard that one and grab another. Go at the widest part of the wound, measure, discard, and grab my third and go to the base. Measure and discard, and taking a final one, I'm going to go ahead and check any undermining or tunneling, and then finally discard. Okay, then I'm going to go ahead and take off my old gloves, discard those, and I'm going to wash my hands, and then I can go ahead and set up my sterile field. I'm going to take my new bottle of sodium chloride to open my containers. Okay, and then I'm going to don sterile gloves. Okay, so now I'm going to go ahead and clean the wound. Go ahead and dip. And I'm going to do top to bottom, clean to dirty, away, discard, take another, dip, clean to dirty, throw away, take another, and do the base, and discard. And then I'm finally going to go ahead and start packing the wound. Start by opening my gauze, the water wick, extra. Okay, and once the wound is covered, the sterile part of the procedure is complete. I'm going to take my tape. And then I'm going to place a piece of tape that says what time, date, and my initials on top. I'm going to cover the patient, back up, make sure the bed is, oops, I take my gloves off first. Wash my hands, and then I'm going to make sure the patient is comfortable. I'm going to slide the bedside table and call light and personal items within reach. And document. I'm going to go ahead and document the measurements, the drainage characteristics, and